Finance to check on what it's going to cost her when she goes into this DC HealthLink exchange. She currently, under the Federal Employee Health Benefit Plan, pays $90 a month as a single individual. Her premium per month is going up to $270. She pays no deductible currently under FEHB. Her deductible goes up to $1,000. So she is paying about $3,160 a month, a year more. And this is a 200% increase in what she currently is paying. Members are having 200, 300% increase in what they're paying. And this is with the the unfair subsidy, that taxpayer, we the taxpayer subsidy that the President convinced the Office of Personnel Management to grant to the members and their employees, even if their income doesn't meet the standards to get a subsidy. If they weren't getting that subsidy, my employee, this young lady, would probably be paying 500% more. And it's even worse in the individual market. When you talk to individuals in my state of Georgia and the states of members on both sides of the aisle, they can't deny it. There's no question about it. The President has consistently said that what is now reality would never happen, that if you like your health plan, you can keep it, period. That's also part of the quote, the period. And this is not proven to be true for the millions of Americans who have seen their plans canceled due to Obamacare and provider networks that have been narrowed to prevent even more sticker shock. Look, this was all about, should have been about, maybe in the individual market in particular, reform of the health insurance market. I mean, that could be done. That could easily have been done to allow young people up to the age 26 to stay on their parents' health insurance policy, to make sure that children with pre-existing conditions could get health insurance, to have high-risk pools within the states, which many states already have. But so what we did is spend about $2 trillion creating a whole new entitled program, which is basically a one-size-fits-all, even though some 55-year-old bachelor now has infertility and maternity coverage that he's paying for, but I don't think he's going to ever need. But now I do believe this, and I'm going to get to my question, and it's going to be for Mr. Roy. I believe that there's another population that will soon feel PAPACA's effects. What a misnomer. It should be the Unaffordable Care Act. But this population has been underreported. We know that $716 billion was taken out of the Medicare program, Mr. Roy. $156 billion from Medicare Advantage. And really to create this whole new entitled program. In the current individual market, we have seen individuals switch doctors as provider networks have narrowed, reimbursements have fallen within exchange plans. With the $415 billion cut in Medicare updates to fee-for-service payment rates to providers, to hospitals, what is the likelihood that seniors may lose access to the doctors and be forced to try to find new ones?
This is an emerging problem, and I know this committee has had debates about whether or not access to physicians among Medicare enrollees is a problem. From what I see and from the data I see broadly, not just MedPAC data, but across the spectrum, it is an increasing problem, particularly for seniors who move to a new location. So a grandmother in New York who moves to North Carolina.
Let me switch real quickly to the other follow-up on
Sure.
that is in regard to Medicare Advantage, the $156 billion that were taken out of Medicare Advantage. Of the 47 million people that have Medicare, 25% of them choose Medicare Advantage. What's going to happen to them?
Richard Foster, the former chief actuary of CMS, said projected that 50% of Medicare Advantage enrollees would revert back to the traditional fee-for-service program because of the changes to the Medicare Advantage program.
Well, Mr. Chairman, the administration implies that the disruptions that Obamacare has caused to individuals will stay relegated to those buying their insurance individually. Our seniors need to be warned that this disorder will soon come to them if it has not already. And this law is not just a disaster for individuals, it's a disaster for our health care system and will soon be a disaster for our seniors. No amount of IT resources will fix the underlying problems. As Dr. Burgess said, that'll be fixed eventually. This is the end of the beginning of the problem, the tip of the iceberg. No amount of IT resources will fix the underlying problem. This bill is truly a train wreck for Americans and particularly for our seniors. And I yield back.
Gentleman's time is